Okay, so now how to decrease tidal volume, or how to control tidal volume in the most commonly used modes. We're just going to talk about volume control and then pressure control. And volume control, remember, we directly set tidal volume because remember, it's the cycle. It's the ventilator will terminate the inspiration once this tidal volume delivered. So you can directly decrease and set tidal volume to be 6 ml per kg of ideal body weight for ARDS, or 6 to 8 ml per kg of ideal body weight. So this is easy. How about pressure control? Because remember, on pressure control, just go back if you don't remember to pressure control video. We only set the proximal airway pressure, the inspiratory pressure, and inspiratory time. So the tidal volume will not be directly set, but will be affected by these two numbers. The higher the proximal airway pressure or inspiratory pressure that we set in the ventilator, the higher the flow the ventilator needs to achieve this. Remember this equation? I'm just going to put it here. Proximal airway pressure equal flow multiplied by resistance plus alveolar pressure. So the higher the flow needed, the higher the pressure, the higher the flow needed. And the higher the flow means the higher tidal volume. So that's one thing. By lowering this proximal airway pressure, the inspiratory pressure, you lower tidal volume. The other thing is by decreasing inspiratory time, because simply decreasing inspiratory time will decrease the volume delivered, because remember, flow is volume per time. So decreasing time will decrease tidal volume. So two things: either decrease the proximal airway pressure set on the ventilator or inspiratory pressure, or decrease inspiratory time will lower your tidal volume. And then you can monitor how much the patient is pulling on the ventilator screen to make sure it fit 6 to 8 ml per kg of ideal body weight. And in ARDS, remember, it has to be 6 ml per kg of ideal body weight. And here we directly can set it. Very important you pay attention to this, making sure your tidal volume comply with the recommendations.